Hi, it's Jessica DeMassa with WTF Health. What's the future health? Joining me right now to talk a little bit about what his company is doing to help out with COVID-19. We have Dan Burton. He is the CEO of Health Catalyst. So Dan, it's a pleasure to have you with us.
Thanks for having me, Jessica. It's great to be here.
Thanks. So for those, Health Catalyst IPO'd last summer of 2019. It was a big deal. You guys have been in the industry for a long time. Data analytics health tech company. And what's cool about what you're doing for COVID, I want to jump right in and talk about this right away, is this COVID-19 registry that you've built off of your Touchstone platform. So Touchstone, as I understand it, 80 million patient records, one of the largest patient health data registries in the country, and you've created this little COVID-19 carve out. So tell me about this, what this is, and who you're working with on it.
Yeah, absolutely. So the Touchstone data repository is really an amalgamation of all the work we do with all of our health system clients. And it came out of the clinical improvement work that we did with all of them and their desire to understand how their improvement work compared to the work that others were doing in this space. And so they asked us to play this data aggregation role in bringing all of their data in a de-identified form together so that they could understand performance. So we've been building that data repository for a number of years now, really since the founding of the company, but in earnest over the last 4 or 5 years. And because it was formed on the basis of doing clinical improvement work, it has a great deal of clinical depth and richness as it relates to the facts per patient, tens of thousands of facts per patient. And most of those facts are clinical in nature. And so when COVID-19 came along, when the pandemic hit our health system clients, it was readily apparent how useful it would be for us to leverage that Touchstone platform to identify populations of patients, registries of patients that would be relevant for us to better understand. And then with that large and deep a data set, it would not only allow us to start at the very highest level in understanding, who's been tested positive for COVID-19, but to go down many levels of granularity and analytic richness in understanding subsegments of populations, those that might be most at risk, those that respond differently to different kinds of treatments, those in different regions of the country, and hundreds and hundreds of other ways in which you can subsegment and then analyze using powerful predictive models, using powerful data science and machine learning algorithms to really understand at a more precise level what's going on with regards to this pandemic and what will be most effective in terms of treatment.
So can you share with us some of the anecdotes of what you've learned in doing this?
Well, I think a good example is unfolding before us. So as you think about where we have been over the last 6 weeks in response to this pandemic, we've really had to begin with more of a blunt instrument type of approach where we implemented lots of broad social distancing programs that were fairly uniform across all subsegments, all age groups, et cetera. And I think that made a lot of sense as we were just learning about this pandemic and this virus. I think data sets like the Touchstone registry and data repository allow us to get more and more granular, more and more precise in understanding as we think about going back to work, what specific subsegments and what specific markers will indicate that it's safe for which groups to go back. And we're still early in that process. And this is a data repository that can not only help right now, but also for a next wave or a next virus that we may face as a country and as a world, a global community. So we're learning as we go, but we're participating, for example, in some national and state level exercises and coalitions, one led by the Mayo Clinic, the MITRE Coalition. We're opening up that de-identified data set so that we can do that sub-segment analysis and really understand in different regions, with different age groups, with different chronic conditions, what should be the guidelines that we follow.
Give us a sense, can you, I know you said it's early days on this stuff, but can you give us a sense of the conversation around it? What are some of the questions, like you're working with Mayo, what are some of the questions that they're asking you or that you're asking them or that you're asking of the data? It's just kind of give us a sense of what's happening in the dialogue around this.
Well, I think many of the questions that you hear discussed in the media are also questions we're trying to all understand.
Okay.
What kind of treatments are most effective? And is there a difference between subsegments of populations in certain treatment protocols? Which vaccines are most effective? So we're involved in helping understand the right clinical trial recruitment to test different vaccines. And obviously we're trying to be supportive of a real fast track in that regard. And data and analytics can play an important role in that. Every state, I think, is trying to understand how should we think about reopening and which protocols should we put in place, what requirements should we put in place, and different countries are following different approaches. And so we're trying to do our small part in providing a rich enough data set so that, for example, in the data repository at Touchstone, while there's 80 million patients, when you start subsegmenting into specific COVID-19 registries, we have about 500,000 patients that fit into one of the specific definitions of a population of interest as it relates to COVID-19. It's important to have enough data so that you can increase the confidence level in your analytics.
As far as moving forward, then, as like, I mean, we move through this pandemic and time evolves. What do you think the utility of this is going to be? Are you going to be able to use it, looking backwards? So, I mean, I know one of the reason I asked is I know one of the newer parts of your business is your life sciences business. And so this was something I spoke to Sadiqa Mahmood from your team about in November, and she was saying that this is like your foray into getting into bringing the molecular data, like genomics data and pathology data, and marrying that with the clinical and claims data that you guys already have access to. So do you see the utility of this COVID-19 registry having implications on finding a cure or finding a vaccine moving forward as you guys work with life sciences companies?
Absolutely. And a similar analogy holds where when you think about vaccine development or treatment development, you often start at a very high level, and then you want to get more and more precise with subsegments of population. So one example with us in the life sciences space is there is a specific subsegment of the population where we're helping a life sciences company think through clinical trial recruitment for a specific set of comorbidities. And here again, without the data aggregation and the large data set of something like Touchstone, it's really hard to get to a large enough sample set to do effective clinical trial recruitment. But by virtue of our partnership with all of our health system clients, we have this large data set with real clinical richness so that you can, if you're a life sciences company, go and subsegment exactly what you're looking for to test in terms of an effective treatment as it relates to COVID-19 and specific comorbidities. And I think that was more of a gap that existed in the past. So we're excited to help fill that gap.
The other side I want to ask about, which is, I mean, we've talked about the clinical side and how you see aggregating this data so that it can be used for treatment and also treatment development. But I want to ask about the cost side. So what are you seeing there? I mean, I've had a couple conversations with folks within health plans or in businesses adjacent to health plans who are talking about how things are really starting to change from a healthcare cost perspective as those organizations look to 2021. How I know that's something that you guys have always focused on is not only improving clinical outcomes, but also improving and operational outcomes, but also improving cost. So tell me a little bit, I guess, about how you see all of this unfolding moving forward.
Yeah, and we certainly at Health Catalyst are quite focused on the provider perspective and experience as it relates to cost. And I think the most notable and urgent item that we're helping our health system clients think about is their own cost structure as they've taken a massive revenue hit because they postponed or canceled all of those elective surgeries and those elective procedures so that they would have enough room and capacity to respond to COVID patients. As we get through the peak, as it relates to COVID-19, one of the significant solutions that we're focused on is helping our health system clients financially pick up the pieces and a specific, precise understanding of your costs and your cost per procedure so that you can understand the relative financial impact as you think of reordering. Which procedures do you start with? Which ones will have the greatest benefit in terms of recovering financially from the devastating hit that they've taken? And analytics is really important there, a precise view, not a sort of a peanut butter average view, but a precise view of exactly what revenue is associated with that and what costs are associated with that, are what we're trying to help those health systems understand so that they pick the right priority order to the greatest positive impact.
Macro level, what does this do to the data that you have? You know, I mean, you started at the beginning that you guys have been building, you know, since the founding of the company more than 10 years ago, but really the last, 4 or 5 years, building out this platform, and you've been aggregating all of this data. And it's like, from a data science standpoint, you like to look at what's happened in the past. And this is such an odd blip now with what has happened over the last couple months in healthcare. How do you reconcile this moving forward, and what do you take away? I mean, what happens to the data asset that you guys have built?
Well, it's interesting. I do think this is an inflection point. And I will share, I think one of the elements that this pandemic has shined a light on is really similar to our focus. Our focus has been at the individual health system level. Let's make sure those individual health systems have the data that they need to make great decisions and improve outcomes. And we're proud of that infrastructure. We found that data infrastructure has been really helpful in effectively responding to this COVID-19 situation as it relates to capacity planning, staff planning, supplies tracking, patient tracking, staff tracking when someone has been infected with the virus. So in many cases, that data platform, that data infrastructure has been validated. What it has exposed is gaps beyond the health system setting. So if you click up a level at the state level or at the national level, we have really a digital patchwork today with many, many gaps that exist from health system to health system. And COVID-19 really exposed that. And that's one of the reasons why I think it took us a while and it required us to use more blunt instrument type policy decisions as opposed to more precision, is that we had just big gaps in our data set. And something like the Touchstone registry, the Touchstone data asset, wasn't initially conceived to be a national data asset per se. It was more another way to help our health system clients at the local level understand how their treatments and protocols compare to others. But COVID-19 highlights the need for a national repository, a national digital infrastructure. And we are hopeful that that will be a learning that persists, and that there will be some investment at the national and state level to make sure that those individual health systems are connecting in an interoperable way and in an effective way with a strong, scalable infrastructure backing it up. And I think that should be a fundamental recognition and change, hopefully moving forward.
Do you think that it's going to be enough to tip the balance here? I mean, this is such an inflection point in healthcare in so many ways. And I also cover a lot in terms of telehealth. And everybody has said now, this is it. Telehealth has hit that inflection point, genie out of the bottle. There's no way that we're going to go back. Do you feel that way from the health data side? Have we hit that inflection point with noticing that how this gap in that data and having that missing national registry and having all of this patchwork and the lack of interoperability? Have we gone now to the point where it's like do you think that policy and investment will change this moving forward?
I think so. I agree with your assessment with telehealth, by the way. We've seen that across the board, that our health system clients have essentially compressed what would have probably taken 5, 6, 7 years of adoption of telehealth in the period of the last 6 weeks. So it's amazing in that regard.
So is this analogous for the health data side of it, you think?
Well, I do. Maybe not quite that quick, but I do feel like because it's so consequential, the fact that we haven't had precision as it relates to our digital health infrastructure, and as a result, we've had to make pretty high level, broad brush policy decisions that have had really dramatic economic consequences. I think because of that, there will be a sense that in the future, we want to be better equipped to be more precise in our response to these things. And you can do that if you have a large enough data set and you have it in the moment that you need that data near real time, so that you can make better decisions. So I do think this will be an inflection.
Okay. We saw at the beginning of the year, those HHS data interoperability rules got passed, and it was like in the middle of the beginning of the outbreak. So it was like they really got like not nearly the notice or notoriety broadly, I think, that they needed to get. And I know a lot of the implementation of those has been put on hold, but did you see those rules as a step in the right direction?
Absolutely. And I certainly understand that we need to help these health systems get back on their feet financially. So first things first, I appreciate the federal government's flexibility with regards to interoperability rules, but I think it's absolutely the right step. And this pandemic highlights why, that we need that free flow of data so that we can make better decisions sooner.
All right. Want to talk about Health Catalyst, the business. So as we said at the top of this, you guys went public in the summer. And congratulations on that, by the way. That's such an accomplishment for the business. And also, I mean, for a data science company here in health tech, I mean, there was a drought of IPOs. And so congratulations on that and everything it meant. I wanted to hear from you, how things were going. I mean, you have your earnings call coming up here in a couple of weeks. How have things been since you IPO'd? It's almost been a year.
Yeah, we're coming up on a year and a couple of months here. And I would share maybe a couple of thoughts.
Yeah,
pre-COVID-19 and then maybe post-COVID-19. So one of the elements that we've tried to focus a lot on at Health Catalyst is our team members and team member engagement. And one of the things that I was really conscious of in interfacing with our team members was they were really nervous. Were we going to kind of lose our soul? Were we going to lose that mission orientation, that culture focus on the team member through the IPO? And so we as a leadership team tried to make some extra efforts to not have that happen. And we use third parties to measure our team members' engagement. And one of the third parties that we use is the Gallup organization. Every 6 months, they survey every team member, and those team members anonymously respond to Gallup's standard questions on engagement. And I think one of the things that I was most excited about is this most recent Gallup survey results earlier this year showed the highest engagement levels in our company's history. And so we were excited to see that team member engagement continuing through the IPO process. And there are still some real challenges with regards to being a public company, but a lot of real positives as well. And one of those is the ability for every team member as an owner in the company to keep participating and receive more equity in the company and have liquid equity in the company, which has been great. So post COVID-19.
Yeah. Maybe this is where those challenges come in.
Yeah, absolutely. It's been, I think, an interesting experience for all of us. First, as it relates to team members, we were already quite remote friendly as a company, but we had to go all remote. And I think, just as you and I were talking before we came on air here, when you're all remote, sometimes the walls start talking to you, and you need to have that social interaction. And so we doubled the number of and the frequency of our all team member meetings. We went from every other week to every week. We doubled or increased the frequency by 2x of the team member manager one-on-ones and required them to always be video, so we could kind of keep in touch with our team members. And then as it relates to our clients, we found that virtually all of our clients needed to pivot from, focus on a wide variety of clinical, operational, and financial activities to almost a singular focus on COVID-19. And so we've needed to pivot and focus there as well, and have introduced 8 new solutions that are specifically targeted towards COVID-19 to help those clients. And we have found that we've increased the communication with our clients to more like daily, in understanding what they're facing, what issues they're facing that they're having to solve manually, where we could automate some of those steps from a data and analytics perspective, and build out tools like the capacity planning tool or the patient and staff tracking tool, or the registry, so that our clients can understand exactly what they're seeing within their health system setting. But we've seen that likewise, as they have singularly focused on COVID-19, that has, as we mentioned before, meant they've reduced dramatically everything else that they do. And that has a real financial impact on them as well. And so we're trying to help them get out in front of that and understand how to reintroduce those elective procedures, how to get back up on their feet again. And hopefully that'll happen here very, very quickly, and we'll see a real strong rebound.
All right, last thing for you. Speaking of your, you have a great relationship with the NASDAQ, so much that you guys have partnered up with them on this Profiles in Courage program. So tell me a little bit about this.
Well, part of what we have recognized over and over again in communication with our clients is the real heroes are those on the front lines. And we've been a small part, a support part in understanding hundreds of these stories of courage of nurses and physicians and others on the front lines that have put themselves in harm's way, often for extended periods of time, in support of the patients who needed them most. And so one of the things that we thought would be appropriate at this point is to recognize and invite nominations of health system heroes that whose stories should be told. And so in partnership with NASDAQ, we've launched that program. We're accepting nominations. We've loved that process of receiving those nominations, and then we'll highlight those profiles in courage in Times Square and elsewhere as well, in really celebrating these wonderful heroic clinicians that have helped our nation and have helped the world respond in an effective way to this pandemic.
That's awesome. That's so cool. And I love the work that you guys are doing there at Health Catalyst to help support hospitals as they're trying to not only, look at their data and navigate what's going on with COVID-19, but also, their own recovery, with so many of them having, like you said, taken that financial hit. So Dan, last thoughts from you, I guess, is there anything that we can do in the broader, healthcare community as we look to support the hospitals moving forward? Is there anything that you think that from your conversations with your client base, from looking at the data, is there anything that we should be aware of that we can do to help?
I think if we can all continue taking it one day at a time and trying to follow what we're asked to do by those who are studying that data, I think that's what we're trying to do as good citizens from a Health Catalyst perspective and from a team member perspective. And I think as we all do that, we can keep flattening the curve and get on to the other side of that curve as well.
Awesome. Dan, well, thank you so much. It's been so great to check in with you. I really appreciate the opportunity to talk to you about this stuff and all of the things that you're working on over there at Health Catalyst. So thank you.
Thank you, Jessica.
Thanks. If you would like to check out more conversations that I have had with different healthcare thought leaders as they're working on tackling COVID-19 in support of the established healthcare system, you can check out my YouTube channel or visit WTF.health. I'm Jessica DeMassa, that's Dan Burton. Thank you so much for joining us.